One, my 64-year-old male patient, non-open angle glaucoma, was on 3 medications, combination of beta blocker and prostaglandin and alpha-2 agonist, and had argon laser trabeculoplasty 10 years back, much before I started seeing him, and it showed definite progression on perimetry, so I decided to do a regular trabeculectomy. It was standard trabeculectomy. I do triangular and rectangular, but this was a triangular case, and ostium excision, and on table there was a good bleb, uncomplicated. I routinely use 0.04 mitomycin for 2 minutes and 1 releasable. That is what I did. And IOP remained in low teens for the 8 weeks. It was fine. I had used the routine post-operative by use for steroid for 8 weeks, starting from 8 times, and cycloplegic for 2 weeks and antibiotic. And after 1 month, I had called for routine, and he showed a nice encysted bleb with pressure of 23. And you can see some corkscrew vessels also. So I decided to start with the conservative management. I usually give 5 FU in the superior 90 degree away. That is what I did. I give 4-5 injections. I restarted topical steroid. The pressure didn't come down, so I started topical beta blocker. The pressure still remained in the high teens, and the target pressure I decided was 14 to 16. So when after 6 weeks, when after starting beta blocker, IOP remained high, I decided to do a needling. Unfortunately, my original encapsulated bleb video didn't work here, so I just put one diagram to show the technique. I will show the needling, which is a regular. The only modification when you do a bleb needling in the encapsulated bleb, the idea is that the wall, encapsulated wall, has to be collapsed. And you should enter posteriorly and make sure that the wall is collapsed. Now there are 2 or 3 ways you can do that. One, you can do a one puncture. Some people advocate multiple puncture in the wall. Some people advocate one entry and then regular sweeping, what you do in the failed bleb, sweeping across the wall. That is what I usually do. Enter from the posterior and sweep across the wall. Basically you make sure that the wall is collapsed. So this is I borrowed from Romney. I hope that it doesn't show the same video.
Cotton tipped applicators.
The only modification, this is a straight needle. I bend the needle at 45 degree. Here we enter from the side in the failed bleb. Here at the end, the posterior
left side
edge of the tenon cyst or encapsulated blob, you enter and you sweep the needle across. You make sure that wall is punctured.
Is forming with dissection.
I usually inject 5 FU or mitomycin before I do the needling and wait for 10 minutes. The other described technique is like inject simultaneously or after you do the needling regularly, and after the needling is done you inject 5 FU or mitomycin. You can also inject Halon. Post-operatively I again started patient on intensive steroid. I gave multiple 5 FU injections. This is the bleb at 3 weeks and this is after 6 months. The pressures are 14 at 6 month visit. I am stopping here. I thought we had decided.
We'll complete it and then we'll have the question.
Do that. Okay, so I'll go a little bit about the summary. The encapsulated bleb is defined as dome shape, elevated, tense, thick wall, demarcated. Nice demarcation here over the trabeculectomy side. Now it can be thick, thin. The definition everybody is using literature varies. Usually happens between 2 to 8 weeks. Of course, it can happen after 8 weeks also. And some tenon cysts have thick, opaque, highly vascularized wall. Some may have thick but hypovascular wall. Intraocular pressure usually is elevated. Again, it is not necessary that pressure always would be elevated. In advanced glaucoma intervention study, the definition they had used, where intraocular pressure was not necessary, 50% of the eye with encapsulated bleb did not have high intraocular pressure. So it depends what definition people is used, but basically if there is a dome shape and if there is a angry looking vessel, then chances of failure is high, though there is no long term study to prove that, what I am saying now. The incidence is between 6 to 30%. More common